And then the beauty of today is Dr. Brower is really going to talk about medical conditions and how they can affect your fertility. So we're really going to look at PCOS and endometriosis, and we're going to kind of do an overview of all those things. So I'm really happy to have you here today, because not only are we going to have Dr. Brower's medical perspective, but then we're really going to look on from a holistic approach and really look at having a naturopath talk to you and talking to you about nutrition, and have Mona talk about traditional Chinese medicine and how these things can really help you along your journey. So we'll get started. Dr. Brower, are you ready to roll? Oh, she's on mute. Sorry. Let's see here. Here we go.
All right, can you hear me? I needed someone needed to enable me to share the slides, so I'm working on that right now. Give me one second.
And if anybody feels uncomfortable to ask the question, as in everyone, you're more than welcome to message me directly, or also Kindbody Rebecca or Kindbody Lisa. And I promise you, any questions that you're dropping into chat, other people want to ask them, and maybe they're apprehensive to ask. And so it always is really helpful. And I have to say, I really love our Kindbody family, near and far, and everyone that's joined us today, because I feel like the chat is such a great opportunity for us to connect in these times that we're unable to be in person, where we truly valued our in-person events. The beauty is that we're really able to connect with everyone virtually. And then I love the community that everyone shares information and books and things. And so thank you to each one of you that have taken time to join us today. We really appreciate you.
Great. Thanks, Tracy. And so, yeah, as Tracy mentioned, what I'll start with today is just talking to you a little bit. I'm going to introduce you to Kindbody, which Tracy's done a little bit of already. And then we'll walk through some of the medical conditions that can impact fertility. And then, as Tracy said, we have some wonderful speakers with us today who can talk about these medical aspects from a different perspective, from a nutrition perspective, and from sort of a more alternative healing with acupuncture, which is great. Kindbody. So at Kindbody, so I'm one of the Kindbody physicians. I'm located here in Santa Monica, but we have clinics in San Francisco and New York, and soon to be in Seattle and Atlanta, and Princeton, New Jersey, and the Bay Area and Los Altos. So many clinics to come. And what we do here at Kindbody is we provide women's health services, primarily reproductive health services, for everybody, right? Our goal here is to try to make this care unintimidating, affordable, and accessible. And so, you know, that's a huge, that is our mission. We do offer a full spectrum of gynecologic and fertility care. So everything from just information sharing, learning more about your body, your reproductive health, your fertility, to treatment for individuals who are trying to conceive, couples who are having a hard time trying to get pregnant, fertility preservation, and then taking care of people who require some sort of third-party reproduction. So we do all of that, and then we support these efforts with our other services, our nutritional services, coaching services, therapy. We work with people like Mona and other acupuncturists, again, to approach all these problems in a holistic way. So the focus of today's talk, is to talk about some of these diseases that we know can impact fertility. And I've made a list of some of them here. Today, we're really going to focus on PCOS, or polycystic ovary syndrome, as well as endometriosis. Those are probably the two most common diseases that we see day to day in the clinic that can impact an individual's fertility. There are other things that can impact fertility, thyroid disease, immune diseases, the main one being antiphospholipid syndrome, hyperprolactinemia, certainly something like structural things such as uterine fibroids, or a history of infection that's affected the fallopian tubes. Those can also impact fertility. But as I mentioned, we're really going to focus on PCOS and endometriosis today. So PCOS, excuse me. PCOS is the most common endocrinopathy in reproductive age women. So it is it depending on where you look, it affects anywhere from, and depending on how you define it, it can really affect anywhere from sort of 6 to 20% on an average of 10% of all reproductive age women. So it's common. We see it all the time in the clinic. And PCOS is also this interesting condition because there's actually multiple ways to define PCOS. So a lot of people think they have PCOS and they don't. And then there's people walking around who have it and they don't know that they have it. And it really at the heart of PCOS is this overproduction of what we call androgens, testosterone being the main androgen. And that can come from the ovaries, it can come from the adrenal gland. But again, it's this excess production of androgen or testosterone that has these downstream effects that can cause infertility. The primary effect is that it can alter the menstrual cycles. So women with PCOS most typically do not have regular periods. It can also symptomatically cause excess hair growth. It can cause acne, weight gain. Women with PCOS are metabolically different from those who don't have PCOS. So I'm sure Dr. Raquel is going to talk a lot about this. Women with true PCOS they're at high risk for obesity, and they have a really hard time losing weight. I have patients telling me all the time, I'm eating 1,000 calories a day. I'm eating 1,500 calories a day, and I can't lose weight. And they are metabolically different. And I really, really think that they benefit enormously from support by someone like Dr. Raquel, who can help them not just calorie restrict, but understand what are the right foods to help them lose weight. And it's a huge, huge part of treatment of PCOS, which I'll save all the exciting stuff for Dr. Raquel in just a second. But that is definitely a part of the syndrome. The other thing about PCOS is that the ovaries have this typical appearance to them where there's lots and lots of follicles. And they're called cysts, polycystic ovary syndrome. So people with polycystic ovary syndrome often think they have cysts, but they don't really have cysts. I actually once attended a lecture on PCOS, and the person who gave it said, the one thing, there's a lot of things we disagree on in PCOS, but the one thing we can agree on is that it's a terrible name, because polycystic is kind of a misnomer. These women don't have cysts. They don't have endometriosis. This is not cysts in the true definition of a cyst. They just have lots and lots of follicles. So I feel like that's a common misconception with PCOS. We sort of discussed some of the common symptoms. Women with PCOS, as I mentioned, are at increased risk for other disorders in addition to infertility, which we'll really focus on in a minute. They are, as we mentioned, at a much higher risk for being obese and with more difficulty to lose that weight. They're at increased risk for diabetes. So if you take a woman with PCOS who has a BMI of 35 and you compare her to another woman who doesn't have PCOS and a BMI of 35, that woman with PCOS, even in her sort of her counterpart that's matched for weight or her BMI, will still be at increased risk for diabetes. There's something about the disease itself that puts these women at high risk for diabetes and high cholesterol and cardiovascular disease. A lot of the infertility that's seen in PCOS is related to these irregular cycles. So because women with PCOS are not ovulating regularly, it's very challenging to know when to have timed intercourse. When is ovulation occurring? Is it occurring at all? And then again, as we mentioned, obesity in and of itself is independently a poor prognosis factor for infertility. So that also contributes to some of their difficulties in getting pregnant. But in general, when we get these women to ovulate, when we can help them with lifestyle modification, they are actually good prognosis patients for pregnancy and conceiving, which is good news. The other thing, so again, as I sort of alluded to already, really one of the mainstays of treatment of PCOS is lifestyle modification, getting support to understanding not just how to calorie restrict, but what are the right foods to eat. Exercise. So exercise is also an important part of that as well. In the fertility clinic, a lot of what we do in conjunction with these other sort of treatments and lifestyle modification is help ovulation to occur. So as I mentioned, these irregular cycles are just symptoms that ovulation is not occurring, and ovulation needs to occur for the egg and the sperm to get together. So we do very effective treatments in the clinic for ovulation induction, which allows a woman who doesn't ovulate regularly to ovulate, and we can know exactly when it's happening so that timed intercourse can occur at home. We use metformin sometimes. As I mentioned, women with PCOS are at higher risk for diabetes and pre-diabetes. So if an individual persists in having that, even with lifestyle modification, we will often use metformin to help with that. I mentioned birth control pills here. Most of our patients are actively trying to conceive, so birth control pills are obviously, they don't work very well if you're trying to get pregnant. They really makes it a lot harder. But in an individual who's just trying to manage her symptoms of PCOS, birth control pills are a mainstay of treatment and are actually very effective and actually limit the testosterone production in the body, and so attack the disease in that way. The second condition we wanted to talk about today is endometriosis. And endometriosis is a very different disorder, but also significantly can impact fertility. So endometriosis, what happens in endometriosis is that the tissue that is supposed to live inside the uterus gets out of the uterus. So in a female, the uterus is filled with this very dynamic tissue, and it's hormone sensitive, and it grows and it shrinks. That's the purpose of this tissue. Every month it grows in preparation for implantation, and then if pregnancy doesn't occur, it shrinks, and that tissue belongs in the uterus. When it gets outside of the uterus, it can cause problems, and that's really what happens in endometriosis. Is that tissue, it gets out into the pelvis, it gets into the ovaries, and it causes problems. It causes pain primarily. So the main symptom of endometriosis is pain with periods. Pain can occur at other times, pain with intercourse, pain with bowel movements. Those are also common symptoms of endometriosis. And then often when women with endometriosis will also report very heavy periods. And again, it is most certainly a risk factor for infertility. Interestingly, of endometriosis, most often we are making the diagnosis of endometriosis based on a person's clinical symptoms. Sometimes we'll see something in the uterus or in the ovary that will give us clues that endometriosis is there, but imaging is not a great way. Clinical symptoms are probably the best way, and really the only way to know 100% for sure if there is endometriosis is to do surgery, to actually do surgery and put a camera inside somebody's belly button, which probably 10, 15 years ago, we used to do more commonly. We do it much less commonly these days, and we often really rely on clinical symptoms to make this diagnosis. As I mentioned, 30 to 50% of women with endometriosis do suffer from infertility. So just because you have endometriosis doesn't mean you're infertile. You know, women with endometriosis can get pregnant, they do get pregnant, but they are at a higher risk to have a hard time getting pregnant. And we don't know exactly why that is. In very severe endometriosis, there can be scarring. So when somebody has very severe disease and the fallopian tubes are scarred down, you can see they're not supposed to be scarred down. They're supposed to be sort of free floating. And if they are scarred, obviously that can impact the ability of the tube to pick up the egg and for the sperm and the egg to get together. But even women who don't have this severe scarring still seem to have some impairment in their fertility. And it's been proposed that there's probably some inflammatory environment. This creates, and we know it creates an inflammatory environment in the pelvis, and there's something about that inflammatory environment that is unfavorable for fertility. And we don't know if it has to do with the way that the tube moves or the way that the tube picks up the egg. Does it affect the way the egg and the sperm get together? Does it affect implantation into the uterus? I think that probably it could alter all of those processes and ultimately sort of lead to these high numbers for infertility. Once again, if you are just treating the symptoms of endometriosis, there are medications that can be used, none of which are compatible with pregnancy. So once again, birth control pills, Lupron, progesterone, all very, very effective at suppressing endometriosis. None of them are good for getting pregnant. So when we have a couple or an individual with endometriosis, our focus shifts from treating the symptoms to minimizing the symptoms with, honestly, things like acupuncture and diet, which I think work very effectively for endometriosis, as well as using our tools for treatment, controlled ovarian hyperstimulation and IVF primarily, to help overcome some of those obstacles that endometriosis creates in getting pregnant. I list surgery here as well. We still do surgery sometimes for endometriosis, and that surgery often involves what we call laparoscopy, where we put a camera inside the belly button and burn the endometriosis. And there's some evidence that in a mild version of it, that can improve fertility. But in more severe versions, surgery is probably not very helpful in improving fertility. So I've probably already spoken for too long because the exciting stuff is still here to come. So I'm going to throw it to Dr. Raquel, who is, now a recent addition to the Kindbody family, which we're so super excited about. And she is not only an expert in nutrition, but nutrition as it pertains to fertility. So thank you so much, Dr. Raquel, for being here today.
Thank you so much for having me. I'm so excited to just be here and be a part of this. And Dr. Brower, you had the exciting stuff too. So that was exciting as well. But hi, I'm Dr. Raquel. I am a naturopathic doctor, but specifically I focus on women's infertility. Like you'll see in the slide, I really look in depth at how nutrition affects fertility. A big proponent of naturopathic medicine is what's at the root cause. I know that's becoming increasingly more popular for people to look more at the root. So that's what I do. I like to look at the root cause of subfertility, infertility, and these conditions like PCOS and endometriosis. So on my next slide, I have a point where I kind of talk about this crisis of infertility that we hear very often. And I feel like it creates like a cycle of fear when we feel like, oh, it's a crisis, it's going to happen to me, it's happened to my best friend, so it might happen to me. And sometimes what I have found from experience, I previously worked at a fertility center within REI, and oftentimes women tend to forget to look at the root cause of their symptoms or what's causing their symptoms. And a lot of times in young women or women that have unexplained infertility, or they are underperforming, have a low egg count, oftentimes there are toxins in our environment that might have entered our system and might be acting as like a roadblock to our infertility. So oftentimes I like to look more in depth, look at micronutrients, heavy metals, try to see what could be causing you to have this subfertility or infertility if you have been struggling to conceive for some time. The next slide is just a little bit about me. My background, I'm a naturopathic doctor, as I said before. I really love it because it's interesting now, because I remember previously a lot of people weren't really in tune with like how important naturopathic medicine was. And so now when I see like everybody getting more like, just motivated about diet and nutrition and how all these things play a part in not just our fertility, but our overall health, it just makes me even more excited to continue to help women in this way. So today we're talking about PCOS and endometriosis. And when I am working with the patient who have these conditions, I always like to start from the top, which is what's at the root. So as we've been talking about today, as Dr. Brower told us, that oftentimes PCOS and insulin resistance kind of go hand in hand. And when I think about PCOS and endometriosis, one thing that stands out to me is this underlying inflammation that presents in both cases. So although inflammation is not a part of the diagnostic criteria for PCOS, it's a huge reason why so many women are presenting with some of these symptoms. Even in endometriosis, doctors have found, or researchers have found, like elevated levels of cytokines, lymphocytes, and macrophages that could be playing a huge part in why endometriosis might be affecting your fertility. So what I like to do is, first of all, look at our detox pathways. So whenever I'm working with the patient, no matter how they are coming into me, I always like to ask them about their history, but first, are they interested in just doing a detox? sometimes we have been overloaded with toxins, or we have been taking medications, or we've been taking hormones, and our body is just in this constant cycle of not being able to perform properly. So I always like to start with the detox, especially when it comes to endometriosis, because like Dr. Brower said, these women tend to have elevated levels of estrogen, which is why progesterone support is sometimes given. But when you have this elevated level of estrogen, your body has this hormonal imbalance that's affecting your ability to conceive or just produce the right amount of follicles or whatever you need for your cycle. So the first thing I like to do is detox and use even just foods to kind of push that excess estrogen out. And detox is a really good way to do that. Whenever I'm looking at PCOS, I kind of approach that and endometriosis the same, which is when I'm using a detox, I don't only like to use just like supplements. I also like to incorporate foods. There are a lot of foods like your cruciferous vegetables, which includes like your broccoli, kale, cauliflower. All of these things have a substance in them called, or a chemical in them called DIM, and this pushes out excess estrogen. So whether you take DIM as a supplement or you just consume it through your food, it's a really excellent way to not only detox, but make sure that you're getting the nutrients so that your body can better perform. Insulin resistance is a very important part of why women with PCOS tend to struggle with infertility, because insulin resistance, it literally causes your body, like Dr. Brower said, to shift that hormonal axis from producing like it should to producing more androgens. So that's why women with PCOS tend to present with like hair on their face, their voices might be a little bit deeper. And so in those cases, it's very important to make sure that we are looking at this root cause and giving these women nutrients that they need to better perform. I even saw like some research that when you have like chronic elevated insulin, it can literally affect ovulation by limiting the maturation process of an egg. So metformin is a really good addition to your treatment plan, because if you cannot regulate your insulin, that insulin is doing more than just causing your glucose levels to be elevated, but it's affecting how you perform in your egg freezing process or how you even implant an egg. So I have like a three-pronged approach when I think about PCOS and endometriosis, which is first, you want to detox the body, like I previously mentioned. Second, you want to make sure that the diet is one that is supporting proper insulin like performance in your body. So oftentimes what I tell my patients is to, when you're thinking about your lunch and you're thinking about things that you consume, you want to make sure you balance your protein intake with an equal amount of carbohydrates. Because what happens is when you have this insulin resistance, you have like this yo-yo. Your body isn't able to properly take in the sugar and do what it should. So you want to make sure you have these equal amounts of proteins and carbohydrates, because this helps your body to have a balanced level of insulin, and it helps to improve your fertility. Also making sure that you are eating foods that have a low glycemic index. Again, broccoli, cauliflower, asparagus, all of these foods are really, really good at improving your glycemic index. And then finally, making sure that you have a diet that's high in fiber. So just like I mentioned previously, you want to make sure that even if you have these elevated levels of estrogen, it doesn't have to stay there. But what fiber does is that it holds on to things like toxins and excess estrogens, and it allows our body to push them out naturally. And so I'm all about assisting your body to do what it knows how to do. So that's the premise of my treatment, is to just give you the power to see that you have the ability to heal, you have the ability to do what you need to improve your fertility.
Awesome, Dr. Raquel. It was awesome. Thank you so much. We really appreciate it. And so now we're going to turn to Mona, who also helps take care of a lot of our patients. And she also takes care of women with PCOS and endometriosis and approaches it from a different aspect. And so we're so excited to have her here to share. Thank you, Mona.
Thank you. So it's perfect that I'm following you, Dr. Raquel, because what you do is primarily what we do also. There's so much that we do as far as nutrition guidance goes, but another thing that we add to it is we want to look at the body and the clinical symptomologies that we're seeing that the patient's experiencing to identify the uniqueness in their issue, right? So for example, a patient is coming in and they have long periods, And when they do start bleeding, what happens is it's super scanty and there's a little bit of mucus, right? That's different than a patient coming in with shorter periods who's bleeding more often due to these issues and has thick red blood, almost like profuse sudden bleeding. All these little aspects to figuring out the right symptoms and taking care of them with nutrition, acupuncture, herbal therapy, and so on is really important for us to really find and to specify. So in Chinese medicine, there are about 4 main factors we look at to see where your body lies. Women usually alongside all symptoms we just spoke to issues, they also experience issues with like their energy level, sleep cycles, so on and so forth. These tell us something. What we're patient in front of dry? Is a patient in front of us getting more damp? Does this patient is she showing more symptoms of heat or cold? Sometimes literally just touching the abdomen, you can see all of those things. You can see if the patient is dry, you can actually feel the heat radiating. You can touch the accumulation just by the touch. And all these factors tell us how we should look at their lifestyle and make modifications. So obviously we have acupuncture, and what it does is it helps regulate the nervous system by really, so let me go backwards. What it does, there's stainless steel that kind of attacks the body, right? So we put the stainless steel in the body, the nervous system wakes up and says, what is this? We're being attacked, what's going on? But it's called a micro trauma. And what that micro trauma does is it wakes up both aspects of the nervous system, the parasympathetic nervous system that helps with processing, and the sympathetic nervous system that usually puts us in fight flight mode, but it keeps us in check also. When the needles enter, both systems finally wake up and they kind of balance. Usually most of us are running in a more sympathetic nervous system, high performance, where we're in like fight flight mode, processing is left for later. And the way women truly recover is through rest. So we're literally pinning you down to make sure you're resting. And then we're encouraging different changes and shifts in your lifestyle to encourage that rest. 1, to give your gut a rest. 2, to encourage better sleep. 3, to address any sort of fatigue. And then 4 is definitely to see what symptoms you have with your issues of this specific condition. So does TCM, which is traditional Chinese medicine, help with PCOS and endometriosis? Yes and no. Yes to endometriosis. We do not completely eliminate endometriosis. As Dr. Brower said, usually if we want to go in through surgery, it's kind of, it's a little too much for the body. But what acupuncture does is it really helps with eliminating the pain, discomfort, bleeding, and almost erratic symptomology of endometriosis, and helps regulate your body so that you have reduced proliferation during, especially in areas that they're not supposed to. So we want to make sure that your estrogen progesterone models are really like balancing out. And then as for PCOS, yes, we can actually shift the number of follicles. There are many studies that show how acupuncture, herbs, moxibustion therapy, and lifestyle changes do truly actually help with that overall. Can we go to the next slide? Thank you. So we just spoke about like how acupuncture helps. So we reduce stress hormones, we increase endorphins, we encourage relaxation. So a little bit of information, men and women. So like I said, women really recover and pretty much reset during rest, and men do this through food, right? So a lot of times during our cycles and prior to our cycles, women continue their normal lifestyle, right? Let's say a lot of women, I mean, definitely in like New York and LA and like the more major metropolitan cities, we're rough with our bodies, right? We are moving fast, high intensity workouts, in and out, moving quickly, barely resting, figuring out the next thing to do. And then what are we eating? We're eating cold, raw, damp juices, salads, shakes, you know, bunch of different supplements that we just heard about that are great. And it's really about scaling back majorly, making sure you're waking up and introducing something warm to your body as soon as you wake up. It's almost like a hug to your body in the morning. A warm water, warm tea, just to first relax the body. It helps start your day in a more calming way than, like, you know, having a whole cold shake in the morning or a juice in the morning. And then after you have your tea or your warm water, then we encourage you to have a warm meal. We do also encourage high density greens like the cruciferous that you mentioned. We just want to make sure it's really well rounded to your body type. We encourage the blood type diet in our practice, and we've seen incredible changes with it. And then we introduce foods that are most beneficial to your body type. Are you the dry type, the damp type, hot type, or the cold type? But truly, more often than not, the women who are dealing with PCOS and endometriosis are damp, cold, accumulated individuals. So we really need to scale back those type of foods in their diet. We can go to the next slide. So what is cold accumulation and how does it look? So in Chinese medicine, the leading cause of it is cold accumulation. It causes blood from moving freely in the uterus. So imagine you walk into a cold room. What happens to your body is you quickly kind of like shiver up and close up. Same thing happens in the uterus. The way you introduce those cold, raw, damp foods literally tells the uterus like, no, I'm freezing right now. I can't. Just imagine a baby coming into that environment in any shape or form. It's not welcoming, right? So what are the cold foods? They include raw vegetables and fruits. We want you to eat vegetables and fruits, but not necessarily raw. Dairy products need to be reduced. I don't believe in eliminating anything in your diet. I believe you should have everything because, one, that brings happiness, and two, it's really about making sure you're eating clean food, right? So if you want dairy, just make sure it's the cleanest form of dairy and make sure it's a little bit and not a lot. Oils and nuts, this is a huge factor for so much in all sorts of hormonal issues, especially nowadays where people are cutting out dairy, reintroducing soy, almond milk, almond butter, cashew butter, nut milk, right? These are extremely damp, cloying, oily foods, and all it really does is just get stuck in the pores. I see people with adult acne that they never had. It's because the pores are being blocked and literally they can't really refresh themselves because how much can the body really clean out when there's so much oil trapped in the cells internally, right? So because you're modifying dairy, just really be careful with your oils and nuts. Oils are healthy. Raw oils are healthier than cooked oils. And then sugars, obviously sugar, insulin, all feeds off on it. Fats, the fat is good, healthy fats. Fatty food, no, they're hormone disruptors. And then citrus foods, which is really interesting, should just be reduced prior and during your cycle. This is a Chinese medical take, but if you don't have the proper energy and you have this like cloying energy and you add a citrus, the citrus is very moving. And if it can't move, what it does is it just creates heat because it's like this energy coming to like move, but it can't because things are stuck. So there's like this rise of heat during a time where your body's really trying to force things out. Another thing which is not very popular when I talk about with patients is tampons. So any sort of internal add-on is not recommended because that area needs to be open and free for release. So we do suggest for patients to shift to the normal pad. I don't even recommend cups. It's just literally let the blood flow. as well as you can. Let it go, let it go. If the body's getting information of something being put up your vaginal canal where things are trying to go out, it's very confusing to the body, right? It's like, no, I should hold on to this. It's telling me not to, but then the body's like, no, we gotta go. So what do the signs and symptoms look of cold? So it's fixed pain in the lower abdomen that's relieved by warmth. Sometimes with certain people's symptoms, if you suggest warmth, they literally say, no. Those people are running hot, right? So, but the people that feel better with warmth, that means there's a cold aspect to their issue. Dark, clotty menstrual discharge, aversion to cold, late or absent periods, and then back pain, diarrhea, vomiting, nausea, or loss of appetite usually tends to fall in line with the cold accumulation. Can we go to the next slide? Thank you. And then just like I mentioned about rest, prior and during to menstruation, women should not allow themselves to become fatigued. Relax on the high intensity workouts, rest as much as you can. We still recommend moving, but definitely nothing high intense. Go on walks, swim, do very light yoga. But again, with yoga, be careful with the inversions. We don't want your body to be signaled to do something opposite than what it's trying to do at that moment. So really just go with the flow of your body and what the messages your body's sending to you. I think there's another slide. Is there another slide? Or did we remove it? Oh, okay.
The one we talked about before.
Yeah. So this is just for your reference. If you want to understand a little bit more about how Chinese medicine looks at the entire cycle of the menstruation, from the beginning to growing follicle if you want to, or when it's time to release. This is just a little bit of information on how you can support yourself during the cycle. But yeah, if there are any issues you are dealing with that you feel like are kind of different in terms of your PCOS or endometriosis, like, yeah, how come some people say that their periods are heavy? Mine isn't. Mine is super light and scanty. Or how come no one talks about low back pain? Or why do people have diarrhea? I don't, like all these little symptoms are giving us information, and it helps us give you the proper diagnosis, proper herbs, and moxotherapy, which is fantastic. It's mugwort that gets burned on the body. I showed it before in a demonstration. It helps wonders for everything regarding menstruation and women's health. And then one last thing that we do recommend also is to help clear out the gut, which fiber helps a lot too, is also probiotics, right? So we're exposed to so many xenoestrogens primarily through food. These are foods that mimic estrogen and the body holds on to it. And we just want to remove it as much as we can through the colon. So yes, fiber helps tremendously, and so do probiotics for certain people also.
Awesome. Thank you so much, Mona. I thought that was interesting. I've actually had a lot of patients tell me, I know you say no cup, but I've had a lot of patients tell me that they've switched from tampons to a menstrual cup and their periods are significantly less painful, which is, I mean, it's hard to think like, why, what about that? What physiologically causes that? But I routinely have patients tell me that their periods are much less painful after they stop using tampons and switch to a menstrual cup. So that
I mean, even if we think of like enemas, right? It's information being put in the body that creates a response. And during our cycles, obviously it feels cleaner. I totally understand. Yeah. But truly the aspect of removing a tampon and just allowing the free flow is the healthiest and most natural way of relieving what needs to be let out. And we have some questions. Do you want me to look at them right now or afterwards?
Yeah, I think Tracy, do you want to, I think do we have time? Do we have time to do some of the questions that are in the chat?
Yes, and I know I see in there, someone's asking citrus, yes or no around your period.
So that's the one that we say try to avoid. Like, if you're someone that drinks like orange juice in the morning, every morning, I wouldn't. One, it's raw, too cold. It depends on how the citrus is being eaten. I would just avoid it a little bit during your cycle. Let the body do what it can do, primarily by introducing warming foods. So yeah.
And Dr. Raquel, I'd love to ask you, because I know you answered in the chat, because a lot of people love maca, and I know maca is talked about a lot, and you can speak to it too, Mona, in infertility and treatment. So I'd love to kind of share some information.
Yeah, so maca is really great. I know I was kind of trying to respond on the side. I didn't know if we have time or not, but maca is really cool because it helps to balance that estrogen and progesterone. I love maca. I think it's really great. And another great thing is that it's an adaptogen. And very often we don't talk enough about adaptogens, but adaptogens are great because they allow our bodies to respond in a more healthy way to stress. So it's not that we won't come in contact with stress, but adaptogens just make sure our body responds in a healthier way, one that isn't so heightened. So maca is great for helping you to balance your hormones and having that healthy progesterone to estrogen, but it's also great for fertility as a superfood.
Yeah, and maca, just like Chinese herbal medication and acupuncture, just like you mentioned, adaptogens, they are all adaptogenic type medicines and treatments. We want the nervous system to respond better to the environment around us, and there are foods that show that they do. Maca is definitely one of them. I personally highly recommend any sort of supplement addition you want to put into your body. The best way to do it is through a formulation that's specifically made for your body, because all of a sudden you'll see that you have reishi and maca and ginseng and biloba and ginkgo biloba and like all these things that are kind of acting on their own, that once ingested can either become trace minerals in the body or they just kind of overload the body. But a formulation that's made for your body, if it's running again hot, dry, cold, damp, is incredible to achieve the highest result you're looking for. Herbs are amazing, and Chinese herbs are founded upon pretty much adaptogenic function. So yes.
And Dr. Brower, you know what, and Lindsay, thank you for asking that question, because we didn't get a chance yesterday. A lot of people were asking about CoQ10. Is there a specific, would you say, any recommended dosage or any information we can share on that, Dr. Brower?
Yeah, that's a great question. So it's probably one of the few supplements that's like, so, we are always trying to work in conjunction with, Eastern, Western, all approaches. But CoQ10, speaking from a Western training perspective, is actually one of the supplements that's actually been studied in randomized control trials and shown to have some benefit in egg quality. I believe it's also in like the cardiovascular literature and other areas of medicine where it's been shown to be helpful. But most of the studies in the fertility world suggests that taking CoQ10, so it really comes in two forms, coenzyme Q10. It should be, most of the studies are 600 milligrams total per day, divided in 2 doses. It also comes in the form of ubiquinone, and they're the same, but the dosing is just slightly different. So if you're and one's not better than the other, but if you're taking ubiquinone, we recommend 100 milligrams 2 times per day. And that's something we're commonly using. And even if we don't, it is commonly being given by a nutritionist or an acupuncturist as well. And we have our male urologists, they will often recommend it as well in a different dose for men who have male factor infertility.
Amazing.
Somebody asked about maca and smoothies in the morning. A lot of people, there's a few ways you can have your morning smoothies to make them warmer if you do want to still include your maca. Make a warm either oatmeal. You can have like a clean oatmeal. Bob Mills has a nice clean oatmeal. You can either pour your smoothie in like an oatmeal bowl. You just make it a little more dense, less watery. Or something people love lately that we introduced a little while ago was like cauliflower oats. So you get riced cauliflower and you can make it sweet. And again, it's super cleansing, great for the body, high fiber. So that's also highly recommended.
I appreciate you giving those types of references, because we do eat a lot of smoothies and salads. Like, what do you tell, and that's, I guess, exactly that. Like, what do you tell women who are used to eating that as a really healthy alternative? Like, how do you warm How do you warm it up? And I think that's
So salads can be warm. If you really want your arugula to be crisp, arugula is better than any other type of lettuce or green because it does have a more heat component to its nature. But make sure you have grilled veggies that are warm on it. Make sure your protein is warm on it. Make sure your salad dressing has some sort of warmth to it, either ginger or some sort of, like a little aspect that warms up the whole meal. And move slow. Don't just jump into this new diet. Make it yours. Take your time with it. The thing I definitely think you should start with is changing up your morning routine. And you just want to start your day off right. Because what that does is it nourishes your adrenals. And then your adrenals can support your whole body hormonally. So just start in the morning. I also really, really like intermittent fasting, gentle intermittent fasting. It could be from like 12 to 14 hours, 12 to 16 hours if you do it. It really gives the body a chance to rest and stop processing food and processing everything else internally. I don't believe in like those really long-term fastings, like people, I don't know, they do like 18 hours or like for long periods of time. That's not what I recommend, but I do believe that you should give your body a true rest during the day so that it can focus on your organ function instead of just processing food.
That's a great tip. Dr. Raquel, someone asked earlier, and I think that this is, we really get caught up in detox and what does that mean? So when you're asking someone to detox, kind of what does that look like and what is that process when you work with someone?
That's a great question. And it made me, when Dr. Brower was talking about PCOS, that is so true. So many women think they have PCOS and they don't. It's such a common thing. And it's like, well, who told you you had PCOS? They're like, oh, I just had symptoms, so I assume. And I think the same thing about detox, because especially with the air in LA right now, it's a very important thing to be conscious about pushing these toxins out of your body. And so what I like to do, if I can't do any heavy metal testing and I'm just trying to start a patient before they do their IVF or IUI cycle, the first thing I like to do is take a look at their diet and just make sure that they are consuming foods that naturally support their body's detoxification process. So giving them like B vitamins to make sure that they have that liver support, like B2 and B6, which is very important for phase 2 detoxification. I also, with these supplements, I like to make sure that if they have time to do like a 2-week detox, I love whole body detox that include both like pills and drinks that you can have throughout that 2-week period to start pushing things out. And so I like to use detox kits are great, but I like to also use the diet as an aid so that we're making sure not only are we giving you things to help clear your liver and clear your GI system, but we're also giving you a diet that supports those things. I think that's super, super important. And what I saw previously when I worked in a fertility center is that a lot of my patients have been on such a long fertility journey, and just a break to just like try, new healthy recipes and cleanse their body and detox their body. Their entire affect was one that went from being very kind of like fatigued and down and very pale to just like feeling amazing. Like, oh my God, I feel better. Like I have energy in the morning. I can do this and do that. And so oftentimes, just from personal experience, a lot of women tend to conceive naturally when they really do take a step back and just clear their body of any toxins that could have been acting as a barrier. So I definitely like to use the detox kits. I think they're great, but also making sure you have a diet that supports it.
Absolutely. And there's some questions in here about intermittent fasting. And I think really what Mona was suggesting is a very, very modified version of that. And especially, and again, we all work in tandem with each other. So It's about working with Dr. Brower, working with Mona, working with Dr. Raquel, and really finding out what is the best for you. Because each and every person, and I hate to say the word snowflake because it sounds, I meant to say it's a thumbprint. I've decided, I'm like, what is a unique thing? But truly, we are unique as our thumbprint, and it is looking at you and your whole body. And that's why truly at Kind Body, our physicians and everyone that we work with, we want to look at the full picture. And I think that's why we really want to present these educational programs as well, that it isn't just a straight ahead shot, and that we're able to really work with you and figure out exactly what is best for you in your journey to get you to build the family of your dreams.
Yeah, definitely. And then I just want to talk about the intermittent fasting during IVF. Yes, I agree. You don't want to do anything extreme because what we are trying to focus on is proper and healthy blood flow through everything. And if you're just making your body more deficient by intermittent fasting, that's dangerous. So definitely not. It's a very gentle approach of being conscious that you're giving your body a break to process instead of just eating any random time. So just having like a clear cut understanding of, okay, I eat from 9 in the morning till 6 p.m. and then I rest. It's nothing too extreme at all. So yes, thanks for clarifying that. And then somebody asked about the diet for the cold. Is it just during menstruation? Definitely during menstruation, but if you can incorporate this as a lifestyle to overall support your kidneys and adrenals, it's key. And also it is sort of like a secret to maintaining youth. The more we secure our adrenals, the healthier we look, the healthier we feel, the longer we live. So that's just the recommendation for it.
Sure. Dr. Brower, will you go to our next slide so we can talk about the discounts? Yes. Show me the money. No, I want to show, we are very proud to say that we're going to offer a 25% discount on if you book, utilize the fertility wellness. Right now, your best bet is to email navigator@kindbody.com to book with either Mona, Dr. Raquel, or any of the nutritionists and who spoke yesterday, Krista, who's amazing. But we have an incredible group of people that are here to virtually support you. And this is our way to really give you a kind body experience no matter where you're at. And in these times of COVID, when we can't get together, this is a great way that we have the opportunity to really connect with you and help you on your journey as you figure out your fertility, or if you're doing IVF, or however your path looks like. And additionally, we didn't go too much into it today because we spoke about it yesterday, but really having a fertility assessment to learn where you stand is so important, to really know where you are, regardless, because then that really helps you figure out, even if you're planning on getting pregnant, thinking about it next year, or not sure if you want to freeze your eggs or where you're at. If you do a fertility assessment, you can really get a look at where you are and kind of help you make your plan for your future. And we do accept insurance, which is amazing, most major insurances, but we also have a kind body benefit. So if your company does not offer fertility benefits, go to your HR person, be the pest, and tell them that you want a really good and comprehensive coverage. And we would be happy to work with your teams to create a program that's best for you and your company. I think that is all the time that we have for today. I really, truly, and Dr. Brower for taking time today to have a conversation. And I want to stop and give a huge thank you to Sam, our tech person, because he literally from day one of doing all of these virtual events has been our ride or die and helping us when we have tech problems and all of the issues. And I meant to thank him yesterday, and then I realized, I'm like, in my Oscar speech, I forgot to thank you, and I'm so sorry that I did not. So Sam, I heart you very much, and we adore you, and thank you for helping us with everything. Everyone who attended today, thank you, thank you, thank you. This will be up on our YouTube channel, and we're so happy to be able to provide this information. I believe there is a survey at the end. I hope there is, and if not, just always email navigator@kindbody. I'm sorry, Jennifer Woods, I'm sending more people to you, but if you have any events or information or follow-up questions or anything, please email our team, and we'll be happy to help you in any way that we can. Anything else, Dr. Brower, did I leave out?
I think that's it.
Yeah. Thank you, everybody. We're almost to Friday. Happy upcoming weekend. I hope everyone's safe and sound, and with all the fires and things that are going on around the world, we really appreciate this time to be able to connect and have a great conversation and be in this community. So thank you for everyone that attended today. We appreciate you. And have a beautiful day.
Thank you. Thanks.
Bye.